Hey everyone, and welcome back to my channel. If you are passing through for the very first time, hi, welcome. I do EMS videos every single week, so definitely hit that subscribe button. And this week we're going to go over a different EMS mnemonic, and it is called FONA. So just like we always do, let's start out with the definition. FONA is a mnemonic that is intended to serve as a helpful reminder of the possible medications/treatments for cardiac-related chest pain in the 911 EMS setting. So I just want to stress that FONA is not meant in order. It is just a mnemonic, a memorization device to remember all of the medications that you can give. I've posted about it on Instagram, and I always get DMs and people always say, hey, it's the incorrect order. So don't focus on the order. It's more about just memorizing the medications throughout the course of a chest pain call. The F stands for fentanyl, and fentanyl is one of the most preferred narcotics when it comes to cardiac related chest pain. Morphine is still in most EMS chest pain protocols, but I will say I have seen a definite shift throughout departments and different EMS services to fentanyl, and they explained it to me whenever I was in medic school that morphine has been linked to higher chances of morbidity in our STEMI patients or our chest pain patients. So anyway, the acronym actually used to be MONA for morphine, but we've seen a shift and now it is FONA for fentanyl. But make sure that you stay within your scope and follow your protocol. And the O stands for oxygen. Many people forget that oxygen is actually a medication, and it is a very common medication given throughout a chest pain call. With that being said, there's been a lot of American Heart Association science out there, and it has started to change the protocols for a lot of departments and EMS services when it comes to oxygen on a cardiac related call. And that is because the science is saying that hyperoxygenating or causing hyperoxemia in our chest pain patients can actually increase coronary artery resistance. It can slow the perfusion of the heart. And if the patient doesn't end up passing from the heart attack, they can end up with an overall larger injury to the heart. So many EMS services and departments are putting protocol out there to keep our cardiac related chest pain patients at 94% and above when it comes to SpO2. If they fall below this, to add supplemental oxygen to at least get them to that range, but never to add supplemental oxygen if they're already sitting in a normal range. And that is just basically to avoid hyperoxemia. But definitely follow your protocol. Be advised that this is something that is slowly starting to change. And the N stands for nitroglycerin. Nitroglycerin is a vasodilator, so it reduces the preload and afterload of the heart, which ultimately can give the patient some sort of pain relief. There are situations where nitroglycerin is actually contraindicated, specifically when our patients are hypotensive. Depending on what your protocol is, many protocols say a systolic below 100, some say a systolic below 90. It just kind of depends. If they have a confirmed right-sided inferior myocardial infarction, nitroglycerin could be contraindicated altogether. And lastly, aspirin. Aspirin is actually a basic EMT drug, and it's one of the first things that we learn about whenever a person is experiencing cardiac-related chest pain or chest pain that isn't from a traumatic origin. They learn to give 325 milligrams of aspirin. Now, aspirin does have some contraindications. It's definitely not recommended in children, and there is such thing as aspirin intolerant asthma. You have to be careful about that. And also, it basically just inhibits platelet aggregation. So it doesn't bust up any current clots, but it makes it to where there's less of a chance that clots are going to form. Any kind of bleeding disorders, GI bleeds, things like that, those would be a big contraindication. But yeah, guys, that's pretty much all I have on FONA. Like I said, this is not in the order that all these medications are to be administered, but it is an easy way to remember all of the medications that you can give out in the 911 EMS setting when it comes to a cardiac related call. Thank you guys so much for watching, and I will see you next week. Bye.